Prolonged Grief, presented by the University of North Georgia's Student Counseling Center. Trigger warning: this video contains content that may be disturbing to some viewers. Viewer discretion is advised. Prolonged grief is grief that lasts longer than 6 months due to the loss of a loved one. It could be associated with death that occurs due to violence, unexpectedly due to an accident, an unforeseen tragedy like a natural disaster, or any unanticipated circumstance. How might it feel to have prolonged grief? It could feel like a part of you also died. Prolonged grief can also include intense sorrow, anger, or bitterness, sleep problems, feeling numb, loss of focus, loneliness, fear others may die, lack of trust in people, challenges enjoying life, avoiding reminders, increased use of substances, or focusing on little else but memories of your loved one. Some situations or history may increase the likelihood of developing prolonged grief, such as the death of a child, unexpected or violent death, having had a dependent relationship with the deceased, lacking a support system, life stressors, past abuse or neglect, and/or a prior history of PTSD, depression, anxiety, or other mental illness. If you are struggling with grief, whether it is prolonged or not, here are some strategies to help you cope. First, it is important to take care of your physical health. That could mean making time for regular exercise, eating nutritious meals, and getting enough restful sleep. If you are having a harder time taking care of your physical health, or notice declines in these areas, contact your doctor or a therapist, as these may be warning signs that you're not coping as well as you could. Managing your mental and emotional well-being is also important. That could include practicing mindfulness and meditation, journaling, using positive affirmations, and engaging in therapy. Practice mindfulness and meditation to stay present and reduce stress. Try to make time to be with friends and family. Staying connected socially can help cope emotionally and feel less lonely. Sometimes people do not want to burden their friends and loved ones when they are having a hard time, but feeling more isolated may increase your risk of depression. You may also find that being in a support group for grief, talking to a therapist or religious leader, or exploring your spirituality individually may be helpful. Set limits as needed in your relationships, and try to be patient with yourself if you are having a hard time juggling various demands alongside your grieving. Keep in mind that special dates and anniversaries may lead to more difficulties. Plan to be busy and to connect with others as those dates arise. For more information on coping with loss, please see our self-help library on our UNG webpage, or check out other videos on our YouTube channel. Please contact our office at 706-867-4402 if you have any questions or would like support. Thank you.